the first thing I wanted to talk about with you is the hot topic throughout New York and throughout the country right now, which is Obamacare, the Affordable Care Act. Most people don't understand it. It's very confusing. It's more to basically get people insured who haven't had insurance in the past. Forever, we have not had insurance coverage in this country for people between the ages of 18 and 65-year-olds who don't make a lot of money, who have low income and don't really have jobs that provide insurance. And this has been a big lack. And historically, these people, when they get sick, this population will go to the emergency rooms. And the emergency rooms provide the emergency care, but they don't get paid because these people are uninsured. And it's kind of passed along to everyone else through taxes and other programs, but it's been a big problem. Obamacare addresses this. There's a certain population that want Obamacare repealed. They don't want it at all. I feel that a form of Obamacare will probably exist going forward. It may be called something else. It may be tweaked a little bit, but I consider it a very good program at this point. It's been in existence for 5 months. One of the problems after the existence of 5 months is that the population that have accessed it are basically going back to what they're familiar with, which is the emergency rooms. And even though they have the health care coverage to go to primary care physicians, they didn't get a primary care physician. Also, there's urgent centers that they could go to, and they don't access those. When they get sick, they tend to go to the emergency room still. A visit in the emergency room costs $580 more than it does to go to a doctor visit, a regular doctor visit. Another problem is that these regular doctors, primary care physicians, tend to be open during business hours, and these people are working during business hours, sometimes at low-level entry type of positions that don't allow you to take off. If they take off, they could lose their job. So they end up at the time when they can go having to access these emergency rooms still. So there's a big draw on the emergency rooms from the Obamacare, all these millions of new people that are registered and now collecting insurance benefits through this program. The program itself basically has 4 metal levels. The first level is the bronze. The next is silver, the next is gold, and the highest level is called platinum. I consider the benefits that you have in this union to be a platinum level program. Okay, that's how good your benefits are. It's the top of the line. I wish I had been an administrator or principal because then I would be able to have the things that you have, because you have wonderful, wonderful programs. Anyways, let me just briefly give you the facts on the metal programs. The bronze program is the lowest cost program, and it only covers about 60% of out-of-pocket costs. The other 40% the patient is still responsible for. Then the silver level covers 70% of out-of-pocket expenses. The gold plan covers 80%, and the platinum is 90%. The problem is with the platinum that the people who can afford it and get the benefits also have to pay a 40% excise tax on the premiums that they pay. This is how the Obamacare is financed. Okay, there's also tax penalties that are imposed if people don't get a plan. And the first year it's $95, the second year it's $325, and it's going to go up every year by 1 to 0.1% of whatever your income is. That's how you're taxed. The way they do that is at the end of the year when someone does their taxes, they look and see, well, what have you paid for your insurance? What is your income now? And they adjust it up for the next level. Anyone earning between 138 and 400% of the poverty level, which is about $11,000 a year, but people earning between 138 and 400% of the poverty level can get subsidies to help them with their co-pays and with their out-of-pocket expenses and deductibles. And they also get tax credits when they do their taxes at the end of the year, depending on what your income is. The higher your income, the less help you get, and the lower your income, the more help you get. the problem is the people who make 401% of the federal poverty level. These people are not really eligible for any type of help. So some of these premiums have tripled or, you know, been ridiculously increased with Obamacare. I have a friend who was paying $1,500 a month for coverage, and the coverage really can't change because he has a sick child. And that child has to still be able to access, hold on. Okay. Anyways, that level has to, the level of care that he receives and the doctors that he sees and the hospitals and so forth have to stay the same. And as of January 1st, his premiums went up to $4,500 a month, okay, which is an incredible hardship on this particular family, you know. At the other end, if your income is 138% or less of the poverty level, you qualify for Medicaid, all right? In New York, between 2000 and 2005, we implemented a program called Family Health Plus. And this basically ensured that population. So what Obamacare calls Medicaid expansion has actually been in place in New York since 2006, totally. So we already have that in place. But for other people in the country, Medicaid expansion is a part of Obamacare that some states did not want a part of. They did not want to financially cover the people between the ages of 18 and 65, even if they were poor. They just did not want to do it. Right now, there are 21 states in this country that have opted out of that level of coverage. At this point, Medicaid covers people between 18 and 65 throughout the country if the state has opted in and their income is low. Basically, 138% of the poverty level for a single person is about $16,000 a year. All of these facts and more details on any of these programs, you can go to the National Chamber of Commerce for Women and Elder Care website, nccweldercare.com, and I've uploaded all of the facts and figures on these programs on those sites. So I'm not going to go into a